Hello, my name is Valerie Lopez, and my disease of choice is influenza, what many people know as the flu. Influenza virus is a segmented negative sense RNA virus, which belongs to the influenza virus gene in the Orthomyxoviridae family. The influenza virus is extremely small and can only be seen through an electron microscope. Influenza viruses are usually classified as three types: influenza A, influenza B, or influenza C. They are classified according to the differences in antigenic and biological properties. There's also a fourth type, influenza D, but it does not seem to affect humans. Influenza A. Influenza A viruses are divided into subtypes. The subtypes are determined by two glycoproteins on the virus surface: hemagglutinin, abbreviated HA, and neuraminidase, abbreviated NA. Here you'll see an image of influenza A. Influenza B. Influenza B does not have subtypes, but two antigenical distinct lineages, Yamagata or Victoria. Here's an image of influenza B. Both influenza A and B viruses can be further classified into clades and subclades, which are sometimes called groups and subgroups. In this image here, you'll see influenza A, the subtypes, clades, and subclades; influenza B, the lineages, the clades, and subclades. Both influenza A and B have 8 segments of RNA. The virus consists of a central RNA core wrapped by two large glycoproteins, hemagglutinin and neuraminidase, within an envelope. These HA and NA glycoproteins are the virulence factors responsible for causing infectious disease. Hemagglutinin binds to the respiratory epithelial cells, allowing cellular infection. Neuraminidase splits the bond that holds newly replicated virions to the cell surface, permitting the infection to spread. Here you'll see an image of the influenza virus anatomy. Influenza C, as seen here, has 7 segments of RNA. The influenza C virus infections generally cause mild illness and are not thought to cause human epidemics. Influenza D, as seen here. Influenza D viruses primarily affect cattle with spillover to other animals, but are not known to affect people to cause illness. The associated infection and organ system of the body. Influenza is a viral infection of the respiratory tract. It primarily affects the upper respiratory tract, but can also extend into the lower respiratory tract. Here you'll see that the upper respiratory tract consists of the nasal cavity, the pharynx, and larynx. The lower respiratory tract consists of the trachea, the bronchi, and lungs. Virulence factors. A few of the factors are HA, polymerase proteins, BP1-F2, PA-X, NS1, and NA. The influenza virus changes easily and often. They are unpredictable, and they can be deadly. Transmission. The virus is transmitted easily from person to person via droplet and small particles, produced when an infected person coughs, sneezes, or talks. Even a small droplet may contain hundreds of viruses. The droplets can enter the body through the mouth or nose to make contact with the person's respiratory mucous membranes. Less often, a person might get flu by touching a surface or object that has flu virus on it, and then touching their own mouth, nose, or possibly their eyes. Pathogenesis of influenza virus. The influenza virus enters the body through upper respiratory tract, where the virus attaches to and infects the mucosal epithelial cells. The virus attaches to the celiac acid receptors on epithelial cells by their hemagglutinin spike present on the viral envelope. Neuraminidase lowers the viscosity of the mucus film in the upper respiratory tract and promotes the spread of the virus containing fluid to the lower respiratory tract. After attachment on epithelial cells, the virus enters into the cell and begins the replication cycle. The infection results in cellular destruction and degradation. Influenza signs and symptoms. Influenza can have mild to severe illness and at times can lead to death. The flu symptoms usually come on suddenly. People who have flu often feel some or all of these symptoms. Fever or feeling feverish, chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and vomiting and diarrhea. Prevention. The main way to reduce the risk of seasonal flu and its potential serious complications is to get vaccinated each year with the flu vaccine. Other ways of prevention are avoid close contact with anyone that may be sick, stay home when you are sick to prevent spreading, cover your mouth and nose, clean your hands, avoid touching your eyes, nose, or mouth, practice good health habits, which include cleaning areas around you, good exercise, and good nutrition. A number of tests are available to detect the flu virus in respiratory specimens by swabbing the nose or throat and then sending the swab for testing. The most common test is the Rapid Influenza Diagnostic Test. The Rapid Influenza Diagnostic Test works by detecting the parts of the virus, the antigens, that stimulate an immune response. The test can provide results within approximately 10 to 15 minutes, but may not be as accurate as other flu tests. Rapid molecular assays. Rapid molecular assays detect genetic material of the flu virus. They result in 15 to 20 minutes and are more accurate than the Rapid Influenza Diagnostic Test. In addition to these two tests, there are several more accurate flu tests available that must be performed in specialized labs such as hospital and public health labs. A few are the reverse transcription polymerase chain reaction, the RT-PCR, viral culture, immunofluorescence assays. All these result in approximately 1 to several hours. Treatment. Treatment for influenza are antiviral medicines. Antiviral medicines control influenza by treating the patient's infection and helping to prevent severe illness that can result from flu. They help reduce the severity of the flu's worst symptoms and can shorten the length of the illness by an average of 1 day. Antiviral medicines treat both cases of influenza A and B and have the biggest impact when taken within 48 hours of the onset of symptoms. Taking antiviral drugs early is especially important for people who are high at risk for flu complications, such as elderly and people with compromised immune systems. Treatment. Currently, there are 3 antiviral drugs recommended for treating the flu: Tamiflu, Relenza, and Rapivad. These drugs work by interrupting the functions of the neuraminidase on the virus surface and preventing the release of viral particles from the infected host cells. Seasonal influenza is a common cause of respiratory infection during the winter months in northern and southern hemispheres and can occur all year round in tropical and subtropical areas. The disease is frequently mild, but can be severe and is a significant cause of mortality in vulnerable individuals, including young children, pregnant women, and elderly and immunocompromised individuals. Annual seasonal influenza epidemics result in around 290,000 to 650,000 deaths worldwide and affect up to 20% of the population, depending on the circulating viral strains. They have a substantial economic impact through reduced workforce productivity and increased pressure on healthcare services. Here I will show you a few of the historical influenza outbreaks. The Spanish flu, which happened in 1918 through 1919, with approximately 20 million to 40 million deaths. The Asian flu that happened in the late 1950s, with approximately 1 to 2 million deaths. The Hong Kong flu, which happened in the late 1960s, with approximately 1 to 3 million deaths. The most recent is the swine flu, which happened in 2009 through 2010, with approximately 152,000 to 570,000 deaths. Thank you. That was my presentation for influenza. Here is my citation pages.